Hello, my name is Sophia Flesch, and I am excited to present a proposal for a study that examines the effect of community gardens as a diabetes prevention strategy. Details we are going to cover in the presentation today include all aspects of the research proposal, including a brief introduction of myself and the research topic, the overall purpose and specific research question, a comprehensive literature review, the proposed methodology and anticipated results, a complete discussion that includes limitations and future research opportunities, and the overall conclusion. As I mentioned previously, my name is Sophia Flesch. I am a registered dietitian nutritionist and a licensed dietitian. I obtained my Bachelor of Science from Michigan State University and completed my dietetic internship at North Shore University Health System in Chicago, Illinois. I am currently a Master of Science candidate in Applied Nutrition from the University of New England with an anticipated graduation date of December 2020, and I currently have 6+ years of food service and operational menu planning experience working as the Senior Nutrition Manager on the Nutrition and Operational Support Services team, or NOS team, within Aramark Correctional Services. Diabetes is an epidemic that affects 12% of the current United States population. As a result, there has been a proactive shift in the standard of care for diabetes management through the screening and diagnosis of prediabetes. The prevalence of prediabetes coincides with the increase of obesity, especially within the children and adolescent populations, as now 1 in 5 adolescents currently live with prediabetes and present with obesity. Similar to the incidence of diabetes, the use of community gardens as an effective and advantageous community intervention has also increased over the last 10 years as they allow individuals to grow fresh, healthy, and affordable foods in shared open spaces. The American Community Garden Association defines a community garden as a shared public space where people in the surrounding neighborhood share the work and harvest of maintaining a garden space for growing fruits, vegetables, flowers, and/or a sense of community. Although I will go more in depth in later slides, it is important to note that community gardens have been known to improve the health and diets of its participants via access to a wider variety of nutritious foods and physical activity opportunities, ultimately reducing incidence of obesity, diabetes, and other related chronic diseases. They are also especially important for low-income and/or food-insecure individuals living in food deserts, as community gardens reduce the need to purchase fresh fruits and vegetables at the grocery store. Major metropolitan cities, such as Detroit, Michigan, that present with large, low-income populations and food deserts have taken advantage of this trend. Right now, there are 1,500 individual community gardens that draw more than 23,000 resident participants every year. It is known that unhealthy lifestyles are the key contributors to the increase of non-communicable diseases such as obesity and diabetes. As a result, medical practitioners and low-income parents and caregivers require cost-effective and successful interventions to improve the health outcomes of their patients and children. Furthermore, a diet rich in fruits and vegetables is an economical and key modifiable risk factor for NCDs. Therefore, with an intervention known to increase fruit and vegetable consumption, the purpose of the proposed research study is to investigate the effects of a community garden intervention on prediabetes biomarkers in major metropolitan cities with large low-income populations. Specifically, this research proposal aims to answer the following research question. Does a 12-week community garden intervention improve prediabetes biomarkers, such as hemoglobin A1C, in low-income school-aged children ages 6 through 13 who are at risk or present with either overweight, obesity, prediabetes, or diabetes in Detroit, Michigan? Through a thorough literature review via Google Scholar and Embase and PubMed databases, there is significant research available on successful prediabetes interventions and community gardens. Prediabetes is defined as abnormal glucose regulation, which results in hyperglycemia, a key characteristic of diabetes. Additionally, the American Diabetes Association, ADA, also outlines a specific standard of care for the diagnosis and treatment for all forms of diabetes. However, prediabetes specifically is diagnosed when an individual presents with impaired fasting glucose, impaired glucose tolerance, and/or a high hemoglobin A1C. It is important to note that prediabetes diagnosis often results in a type 2 diabetes diagnosis, and that hemoglobin A1C is the most common administered diagnostic test to determine blood glucose control. The table on the right-hand side of that slide outlines the resulting diagnosis based on an individual's A1C. Given its insidious onset, prediabetes can remain asymptomatic for a long period of time. Therefore, the ADA standard of care recommends risk-based screening for both type 2 diabetes and prediabetes in asymptomatic children and adolescents if they are overweight, obese, or present with one or more risk factors. The risk factors for prediabetes in children and adolescents include family history of type 2 diabetes, if the mother presented with gestational diabetes during pregnancy, and some race and ethnicity such as Native American, African American, and Latino. The ADA standard of care also outlines several lifestyle modifications for prediabetes treatment, including weight loss, participating in regular physical activity, and incorporating a healthful diet rich in fruits, vegetables, lean protein, and whole grains. The current literature has also outlined how interventions can be successful. For prediabetes, intervention at the prediabetes stage is critical in controlling the diabetes epidemic, focusing on education and encouragement of a healthy diet and physical activity, especially at a young age, as this will prevent them from continuing unhealthy habits and possible bringing overweight and obesity into adulthood. Specifically related to low-income populations, behavior changes that overcome barriers specifically related to safety, availability, convenience of purchasing and preparing fruits and vegetables, transportation quality, and variety are key for success and longevity. As mentioned in previous slide, due to their increase in popularity, the numerous benefits of garden-based interventions, such as school or community gardens, have been extensively researched. Research has shown that children and adolescents that participate in a community or school garden have increased cognition, specifically as it relates to science. They have increased physical activity opportunities and increased fruit and vegetable intake, preference, knowledge, and willingness to try new fruits and vegetables. Due to the increased fruit and vegetable consumption, there is almost an automatic increase in micronutrient and fiber consumption, as well as an increase in community development, such as civic engagement and neighborhood beautification, which is extremely important for low-income populations and areas with high crime and vandalism rates. Given these emerging themes in the literature, the research moving forward seeks to explore a community garden intervention's effect on hemoglobin A1C. Therefore, the goal of this study is to reject the following null hypothesis: that a community garden intervention will not improve prediabetes biomarkers, such as hemoglobin A1C, in low-income, school-aged children who present or are at risk for overweight, obesity, prediabetes, or diabetes in Detroit, Michigan. The proposed study's participants will be low-income children, male or female, ages 6 through 13 living within the city limits of Detroit and/or attend Detroit public schools. Using a G-power calculation of a medium effect size, an error of probability of 0.05, and an estimated power of 0.95, the minimum population required for this study to be statistically significant is 210. Participants will then be divided into 2 equal groups, a control group and an intervention group. The proposed study is also of experimental design, specifically a randomized controlled community trial, proposed in partnership with Detroit Public Schools and Crowell Community Center in downtown Detroit. For 3 months, the intervention group will participate in a 45-minute after-school community garden program 2 to 3 times per week, led by Detroit public school teachers and volunteer registered dietitians and community center employees. Study participants will conduct any hands-on experience with planting, growing, and harvesting fruits and vegetables at the discretion of the community garden leader. The control group will not participate in an after-school community garden intervention. Since the proposed study uses children as participants, both parental permission and child assent are required. For study participants under the age of 7, an oral child assent is required, and for participants between the ages of 8 and 13, a written child assent is required. Based on the federal regulations under the IRB, this study poses minimal risk to all participants. Quantitative analysis will be used to assess participants' prediabetes biomarkers, i.e. hemoglobin A1C, prior and following intervention. Hemoglobin A1C and BMI will be obtained and recorded via the school nurse or participant's healthcare provider prior and following the intervention. Baseline levels of physical activity, fruit and vegetable knowledge, and consumption will also be noted via questionnaire prior and following intervention, written or verbally via the school teacher based on the age and literacy status for both groups. Age, gender, height, weight will also be noted as well. To ensure confidentiality, all quantitative data required for the study will be collected via the participant's school nurse or healthcare provider, who will also assign a 6-digit participant ID number. Furthermore, only one researcher will have access to the participant ID numbers on a password-protected computer. These participant ID numbers will be associated with the patient's age, gender, anthropometric measurements, hemoglobin A1C, physical activity, and fruit and vegetable consumption and knowledge, as well as come pre-identified from the school nurse or healthcare provider. In terms of data analysis, an independent t-test will be used to determine if there is statistical difference between two group means. All data compiled will be emailed directly to a professional statistician to determine reliability and validity. A chi-square analysis test will test the difference between the control and intervention group, and descriptive statistics will be used to describe the populations of both groups. Lastly, a mean average will also be calculated to determine the impact of hemoglobin A1C change. Based on the comprehensive literature review, participants in the intervention group are expected to experience positive changes in hemoglobin A1C when compared to initial baseline following the study, as well as when they are compared to the control group. Additionally, those in the intervention group will present with improvements in physical activity levels, weight status, and BMI, and fruit and vegetable consumption and knowledge. Therefore, the interpretation of data collected will prove the following null hypothesis. A community garden intervention will improve prediabetes biomarkers, i.e. hemoglobin A1C, in low-income, school-aged children who present or are at risk for overweight, obesity, prediabetes, or diabetes in Detroit, Michigan. For discussion purposes, the limitations imposed on the study include a high sample size and the use of self-reported data on fruit and vegetable intake and physical activity from the participants. Self-reported data is often unreliable and increases the possibility of desirability bias. Delimitations, or future research opportunities, include qualitative studies, specifically related on how to improve and address barriers associated with community garden involvement via focus group analysis of the study's participants and volunteers. In conclusion, as the prevalence of prediabetes and diabetes continue to increase, investigating new, cost-effective ways to control blood glucose is critical for all populations. The CDC agrees that there is a critical need for effective public health strategies that promote healthy eating habits, physical activity, and stress management, especially within the youth population. Community gardens overall are an effective lifestyle change program that can improve prediabetes risk factors and food insecurity. Presented on the screen are the references used, which then concludes the summary of the research proposal. I thank you for your time.